had brought this, sorry, I have brought this family up before, but it's not the one I was talking about in group supervision. So this family is a family of four. Um, the parents and two adult children in late 20s, early 30s, daughter and a son. They initiated counseling to because the parents were abusing drugs when they were probably from about the age of 11 until the younger girl, probably about age 11 until maybe a few years ago. And so they have three children. Their oldest daughter is completely estranged and is not part of the counseling. And the two younger ones are very close, son and a daughter. They're very close. And the son has always maintained contact, but the younger daughter recently, probably about a couple of years ago or a year and a half ago, maybe decided not to talk to the mother. They She did maintain contact with her father, but their issue was that nobody ever talked about the elephant in the room, right? And nobody ever talked about or addressed the substance abuse. And so the father, because he was seeing those children, the two younger ones, but didn't want to see the mother. And so he got tired of that. And so he wrote them a letter and said to both of them, we're a package and, we're together. And so, I want you to include your mom.
The
So
dads wrote that letter to the children about mom being a pack.
yeah, just the two younger ones, because the older one, they can't seem to communicate with.
Right.
And so then after a little while, after they got that letter, I guess they talked about it between themselves and decided, yeah, okay, we will try to do that. And so they initiated counseling. They had initiated counseling about 3 years ago, and the mother didn't show up. So they kind of gave up. And so this time they were a bit hesitant, not really
Right.
trusting, not really believing.
Right.
So it's been good so far. I've had a family session. I've had a separate session with the parents and a separate session with the son and daughter, and then another session we recently had together, which is the one that I want to sort of discuss. So
Yeah,
the
the
mother,
last session was everyone together, all four of them. Yeah.
yeah, all four of them together was an extended session. I felt it went quite well. The mother was very, very open to talking. I had talked to her sort of individually, exploring the older estranged daughter as well, which was a really difficult thing for her. She doesn't know why. She says she doesn't know why and wasn't told why. And she had decided that she had been
Sorry,
trying and
can I ask a
trying.
clarifying question? You said
Mm,
she doesn't know why it was difficult, or does it? You said she doesn't know why. Can you kind of just expand
she,
on that?
yeah, because we had done some exploring around with the parents around the oldest daughter who's completely estranged, and the mother's version and the father's too was that she just cut them off without explanation.
Doesn't know
And
why
so
in terms of like why she's no longer willing to communicate. Okay, that answers my question.
yeah, and she won't respond to them when they try to contact
Mhm.
her. And so during this last session, um, we sort of the mother was really open to talking about her feelings around that, and also her feelings around what was happening with what she was afraid of with the two younger children. And so
How old are the daughter and son, the younger ones?
27 and 30.
They're both adults, okay.
Yeah, yeah. They're both in ha happy relationships. They're comfortable. The daughter has her own counseling. The son has not had experience with counseling. Um, and so they had talked, both the parents and the children separately had talked about, um, before the drug use started, that things were good. They had a lot of fun with their father. They had a lot of fun with their parents. They did a lot of things, went camping, went tobogganing, and all these things. They talked about family activities. The parents were drinking at the time, but not using drugs. When when the girl was about 11 or 12, they moved to BC from Ontario, and they after they moved to BC, they started using cocaine and other drugs, and using them a lot. And so the younger girl, most of her memories are around the drug abuse. The son has stronger memories of earlier when they had good times together as a family. He remembers that, and he remembers good times with his father particularly. Um, so the daughter is much more hesitant and not quite, she's not really ready to for she wants to know why. Her goal is to find out why they what she describes as they consciously chose to choose the drugs over the children. And so that's her thing. She wants to know why, and she also wants to know why in the past, when they tried to restore the relationship, the parents were just in denial and didn't really, didn't want to talk about it.
Mm.
They do talk about it a lot now. They're very open about their feelings around it. Both of them work with homeless and addicted people now. That's their both of their jobs are like that.
Mhm.
And so they talked about to the children what, trying to help them to understand the addiction, and how they weren't aware that what they were doing was really harming their children. They thought, the mother said, I just thought that I was doing, everything I should for my children. And I wasn't aware that in actual fact, we were doing a lot of damage. She apologized a lot. She talked a lot. And at one point, I sort of, we sort of got into an enactment. Um, but I guess what I really want feedback on is, when I think about EFT, and when I read about EFT and I watch EFT videos and I listen to Sue Johnson, I read her books, and it just seems like you sort of think that when you do an enactment, that the other person will sort of receive it. But I'm finding that they don't always. And so I guess that's what I want feedback on is, how many times do you do those enactments in those raw emotions when the other person is not quite receiving it yet?
Good question. Yeah. So first, I don't know what necessarily gives you that indication that the receiving individual will always receive it well. If I understand you correctly, it's that they're gonna just take it all in, and they're gonna be able to be compassionate every time, and regardless of how much the history kind of informs what's their experiences right now. I think one way to reframe this is to go, despite the children not receiving something well, is there still a value to do an enactment? I think that's a way to reframe it. And if the answer is yes, are we still getting something out of an enactment? Meaning, when we pass the ball on to the expressor to both go into their vulnerability, and then even more importantly, pass on that experience, to express to the other side what that's like, which is another level of vulnerability, right? One is kind of just with you and them, with the other person being in the room. But now when we're asking them to do it, it takes it up a notch, right? It takes it to another level. That's a big ask, that's a big risk, right? And to me, when that happens, it creates an experience, right? It pulls on the attachment, um, uh, attachment itself in a different way than when you yourself are trying to reframe and reflect through what you're noticing in their how this impacted their attachment, and you're trying to deepen and distill and rev and risk and all the things we do in EFT to get them to that vulnerability, right? You're using the attachment to get them there. But the only way to change the attachment from whatever the insecure form is to a secure one is to create these corrective experiences, which we call enactments. So they don't have to go perfect, right? And they often don't, but the question comes back to, is there value to doing it? So what's in the enactment that you did? And again, I don't know how all the variables that go into it, because you didn't tell me, meaning, could you have done better to get it deeper? Could you have done better? Probably, right? I'm sure there's always that sense. And the hotter it is, the more they're feeling it, the more visceral it is in the room. Yes, the more likely and the better they're able to congruently share that with the other side, the higher the likelihood. But even then, you could do the perfect enactment. But what is the receiving side actually hearing? What are they going through? And the only way to be able to uncover that is to have, in this case, is that the mother do the enactment to the daughter, it sounds like. The only way to get a real visceral, what is, is the apology real? Is the vulnerable thing they're sharing real? Is that they can see it in the expressor's eyes. That moves the experience in some direction. And you can't just pass it yourself, or you can, and sometimes if they're able to stay with it, they can sort of see that the other person's experience was real, but it's not the same, the same depth that's going to pull on the same, quote unquote heartstrings as them doing it themselves and them receiving it.
Yeah. So they did. She was speaking to the daughter, on the son as well, but mostly the daughter. But so it's okay if you get things like yes, but I want to know about this, or
What does that mean? It's okay.
Sorry?
What does that mean? It's okay. Is it okay that you get a yes, but?
That does that still have value? Like, does that still can I understand then that they still heard and received it, even though the reply they gave wasn't emotional, the response?
That's the question. The question is it okay? The question is, what did they hear? What did they receive? Not what, yes, but not what actually was said, but what was heard, right? So I'd want to know on both sides, right? So even if you can't catch the bullet, so to speak, ideally you want to, right? You want to protect the person that's taking the risk, and deepening is one way to do that. And gauging whether the other side is ready to hear through your ability to to sense where they're at as you're going deeper with it. All those things are great, but even then, like I said, sometimes it happens. So then the question is, what did the receiver hear? You need to get context in order to protect the person that did the expressing, right? That context is important because in the moment that it's happening, either it's going to reinforce some kind of belief, a not good belief, right? That I'll never do this again, or this is too painful. think of trauma as it's not what happens again, to use Gabor's word, it's not what happens in the moment, is how did they end up internalizing it at the end of the experience, right? And the initial response is not what's going to determine whether it's sort of this traumatic experience or not. It's how do they understand it in order to let it in? So if you leave it as such, and there's no color, no context to what the receiver heard, then they'll just take it how they take it, which is actually part of the cycle. They'll
So
take it
should
based on the history.
so should I be then saying to the receiver, how how did you perceive that? How
It's
what was it that
it's one
you
direction,
heard?
sure. Yeah. But I would reflect first, right? I would reflect, oh, so it sounds like you're saying this, or it's like, oh, this is a really mixed experience, or maybe a part of this is landing for you, a part of it isn't. It depends on what it is that I heard. I'd want to generally, I want to frame it as multiple mixed experiences, because what we want to first do to protect the expressor is, was anything good about it? Did you hear anything that maybe you and your maybe we can start with, to make it really concrete, what is it that the mother shared, and how is it when she shared, what did it look like for you, not for the receiver but for you? What did you take away from it?
It felt genuine, and it felt, so-called hot to me.
So it
Um,
was primary, you felt what she was expressing was congruent with the words she was using. And then now, to make it more specific, can you be specific around the language? So it felt genuine, the emotions were there, and what was the language that she shared, like roughly?
oh, do you want me to play it for you?
No, that's okay.
Oh, okay. Um,
Um,
so
yeah,
she
just kind of, yeah.
she was describing hurt, and I asked her. I mean, she talked for quite a while, but
Oh, the
towards
enactment was long.
yeah. So
Yeah.
towards sort of
So
the
just
end.
on that note, so when you say a while, what does a while, like a minute? Like what would you say a while is?
It was about 3 minutes.
Yeah.
3 minutes.
So how much of those 3 minutes would you say she was in primary experience? And
Uh,
how much of those 3 minutes was she not?
the last one or so.
Maybe the first half she was, and the second half she wasn't?
No, I thought the second half she was.
She was, okay. So
That's
there you
why.
go. So yeah, so in the first minute and a half where she wasn't, did that have had anything to do with daughter not being able to be present for the second half? As wonderful, as perfect as the second half might have been, but could she have been triggered by anything that was said in the first half?
I honestly, myself, I just got the impression that the daughter was just not ready to
So even before
trust.
she was sharing.
Yeah, I
Okay.
just,
Yeah.
but both of the children did like validate what their mother said, like, thank you for sharing that. But the daughter had this yes, but I don't understand why um, this didn't come earlier, why this took so long, that kind of
Mhm.
thing.
Okay, but that's a mixed experience. So let's say even it wasn't a 3 minute. First of all, I'll just quickly point to that.
Mm.
Generally, successful enactments are under 10 seconds, even less than that. The reason is because you've distilled it down. They already know the context for their enacting. The
Well,
only thing that's left over is, so the enactment is just primary experience that you've already distilled and encapsulated even in the language that you're providing. It essentially just needs to be, if you're talking to me about hurt, what is the hurt like? You, before then, the context was already provided that
yeah,
engaged her prefrontal.
and so that's what I did. I asked her what the hurt was like.
Yeah.
So what it in terms of talking about the sort of time of the enactment, then what how would you encapsulate what part of that is an actual enactment and how long
Do you
it
feel,
took?
if you feel, I would not pass it over until you're feeling the hurt. And then I would say, and once you feel it yourself, that you have a good grasp, the imagery around the hurt, maybe where it is in the body, that you can see the emotion that comes with it, that those are all indicators that she's congruent and in her primary experience. It doesn't necessarily mean she's going to be able to share it in the same way that she's sharing it with you, but she's in the experience. And then you can go, can you share that hurt? Just like you did with me. Can you share that? And if she's sharing anything other than hurt, then it's telling me that she's not ready to share it in this way yet. Because what's going to land well is just primary.
So if you listen to that, then can you tell me?
Absolutely. Yeah. Yeah. But even just knowing that it was more than 10 seconds, right? They teach you this actually in the crisis center. This was a good learning. Always end your reflections with a feeling. Because if you end with anything but feeling, then what is the person going to hear? So if I go, you're feeling blah, blah, blah because of this and this and this, all they're going to hear is the this and this and this. Whereas the this and this and this leads you to feel XYZ, they're going to hear the XYZ. It's the recency effect, right?
Mm-hmm.
And in this case, the enactment is feeling, and that's all that's left over, because that's what you want to have land, because that's what opens up the mirror neurons.
So she talked about the hurt, and so I asked her to talk about what's underneath the hurt, and she was emotional at the time. She was crying. She said, I'm scared. I'm so scared I'm going to lose them, like I did Sarah.
That could be a good, so it's your choice as the therapist, what emotion is most alive in the room. And we don't double barrel emotions. When we're doing enactments, we're picking one thing that is that you believe is either the most poignant, the most alive, or that is going to be received the best, right? The idea of EFT is to move in the direction that moves them from whatever cycle they're in right now to whatever cycle they want to be in. So we meet them where they're at. Where are they both able to express and the other side able to hear, right? And it's a window of tolerance in essence on both sides, right?
So I shouldn't be asking her what's under the hurt?
Absolutely, you should be. I don't know what it means for something to be under the hurt. What you're after is the primary experience.
Yeah. So
I'm talking about what is it that you're ending up enacting? So you're not picking multiple emotions, you're picking the one emotion that's the most felt for her at the moment.
Yeah, what she's scared of. So her fear.
No? The fear, not the what she's scared of, but fear is what one, if fear is the emotion you're going to go with, both the transmitter needs to be feeling the fear and the receiver needs to be hearing the fear. Meaning, whether you use the word fear, you're using the word scared, you're using the word hesitant, you're using the word I anticipate, any of those words, the words don't matter. It's what is the felt sense in the room? What is being energetically relayed to the other side? That's what's going to be heard. The words don't matter. Mm-hmm. Unless there's a clear conflict between the words, and then it's not very congruent.
But you had talked about double barreling. So I'm just a bit confused around double barreling.
Generally, when we're doing an enactment,
yeah,
and generally with emotions in general, right? You only feel one emotion in one moment in time. So if you're asking someone to share multiple emotions, it's not going to come across as a clear signal. They're going to go from one, right, and then they're going to go to their head,
right,
and then they might go to another. So which one then are you wanting the receiver to respond to? And that's why enactments need to be short. So if you've done all the work to get them to the feeling, And by then the other side is in essence is with you. They want to see the other side getting to this level because this is not part of their current cycle. They haven't seen mom this way. This is new. She's revealing a part of herself that is new. It's new. It's by new, it's not new information, it's new experience. This is part of their new cycle that we're trying to help them facilitate. So we're meeting them where they're at. And that does mean also on the receiving end. So if this is information for you as well for the future, is receiver able to hear this or not, right? Or what are they able to receive? And what did they receive from what mom shared, right? So we can do as much as we can to frame it and encapsulate it. But if they're still not receiving it the way you did, then what did they receive? And even from her response, as much as you didn't keep it 10 seconds, you didn't do all these, as much, she still had a mixed response, which is exactly what you would typically see in the beginning. And yes, I appreciate her saying, I would have loved to have seen this 10 years ago or whatever it was, right? This would have been so good. So a part of her is wanting to let that in. It's a mixed experience, so you could reflect. So a part of you would have loved to see this years ago, right? And another part is saying that it's too little too late or something to that effect. You've got two parts right there. So what if she had said this to you 20 years ago? What would that have been like? Talk to me more about that. Have her reflect that part. It's still there, right? It's still a part of her is aware that she would have had a really good cathartic, release or whatever, the healing 10, 20 years ago. But even now she's aware of that. So it's not like she's closed herself off. What I hear is one part would love to let it in. The other part's extremely scared.
Yeah.
Right? Or one part's, I want to hear more about the one part of the experience that wants to let it in, but I don't want to ignore the other part. I just want to say, can you share this? Open up the first part, because mom just took a big risk. Open up the first part. Can you let her see what you just shared with me, that if you would have received this 10, whatever, 20 years ago, what that would have been like? You're creating that. It doesn't matter that you're saying this 20 years ago. You're bringing that to the surface, share that, reinforce mom of sharing more like this, especially if you can identify what part of what mom just shared, brought this on the most. When she shared, so then you can turn that into the receiving enactment. Mom, when you shared with me how scared you are of losing us, right? Here's what that brought up for me. The rest doesn't matter now, right? That was maybe 5 seconds of it. That's what brought it up the most. That tells mom to reinforce sharing that it connects this one-to-one thing with, when I share this 1 second, that's what my daughter responded to the most. It grows that, right? And now let's talk about this other part, because once she gets the response from the first part, she'll be more able to hear the second part, the not, the yes and. Open up the yes, and then have that shared back. Let mom process that. What was that like to hear the yes opened up? Now let's get to the but. Open up the but. What made it so hard to hear? Yeah, because of 20 years of pain. Of course, there's going to be resistance there, right? There's the message of, why did she wait so long? Or were we not, like you could turn that into both a way to give context to mom, what made it so hard to hear or to let in. Part of her, the yes is the part that says, yeah, I want to let it in. I want to believe it. It is genuine. And then the but is saying, hold on, if I let this in, how do you account for the what I wrote down? I wrote this down because I think this was key. It's a huge piece. You said, or she said, why did you consciously choose the drugs over us?
Yeah.
That's her resource. That's her protection, holding on to this belief. And it's also the thing that's preventing her from letting this in. It's a double-edged sword. It is a coping that she had to learn. Because the moment you believe mom chose this consciously, you can turn yourself off from needing mom and depending on mom.
Yeah.
And she needed to do that. Today, we're talking about, again, opening up. And when I say depending, reattaching is maybe a better word as an adult. Reattaching, it comes with a risk. Am I going to experience what I experienced before of the experience of mom choosing something else over me? Whether it's drugs or anything else, in this case, it's drugs. Maybe the same trauma can happen if she chooses something else over me again. So I have to be tentative about letting this in. So validate that. That makes so much sense. Once you, from the ground up, learn from her why this resistance is so necessary. But you see, without doing the enactment and without seeing she's not able to fully let it in, how do you get this information? Because it's experiential information.
That's really helpful. Thank you.
It's not enough to just ask. You need to see how they respond to each other. You need to see them in their own system. Unless you get them to do that, to interact, to turn it from an intra you and them experience, right, into an inter cross the two of them experience, you don't really get to see in the same way, like you're doing individual and you have to cross it over to see what the reality is, but also where they're at as an assessment tool. And also it's the only thing that will create the corrective experience in real time because the attachment figure's in the room.
Okay. I do.
And that's why it's the crux.
That makes it, yeah, that makes it a lot more clear for me.
Yeah. So that's why I've always said a quote unquote bad enactment is still better than no enactment because of what you're able to gain from it.
Can you listen and see if I was doing okay, or can you listen?
Absolutely. We can maybe go back to a minute or two before you asked her to do the enactment. That's where I'll tell you, like, was she ready, or could you have done something where oftentimes I see clients are ready, but what we end up asking them to enact is not specific enough.
Okay.
And that could be, and also letting them talk for 3 minutes, I think. If it was specific, the request, it wouldn't have taken a minute and a half to get there, I think. And that is really important. That, oh my God, I can feel your hurt right now. I can feel it. Can you turn to her and share that hurt with her? It's that's so important. The thing I'm asking them to share is the thing that I believe the daughter's going to respond well to. But again, we've talked about before about hot is one thing. That's what we just described, that it's ready to be shared. But are they ready to share it in this way is another question. So I always ask, especially with trauma, and especially when there's a lot of history, what would it be like to share that hurt with her in this case? Can you look at her, looking at her, does it feel safe right now to share that hurt? Would it be hard? Do you feel comfortable? On a scale of 1 to 10, how dangerous does it feel to look at your daughter and share this hurt with her? And if it's anything above a 5, okay. So when you shared with me, you could really inhabit that. But the moment I get you to look at her or consider to share that with her, a lot of fear comes up. So I think today we're just going to share the fear, right? Can you tell me what the fear is of? That she would do what? She would not accept it. What would tell you that she wouldn't accept it? What would she do? Would she tell you, yes, but? Okay, now you're priming the thing that she's afraid of, which means you're less likely to get that, right? Or what is it that you're afraid of? Can you share that with your daughter? That you'd love to be able to share this pain, but there's so much fear around, getting this response or that response. You're scared that this will happen, right? Now, can you share that fear? And some people don't like the word fear. Maybe something else fits better, right? That you anticipate this is what she'll do. We're talking about the same thing, right? They're just scared to use the word fear, like opening themselves up, because maybe people have trauma around being open around fear. Maybe shame comes up, right? You can learn about, you know, where's that shame coming from? Where do you remember maybe taking a risk like this and it not going well, right? Then whoever else is in the room can find out exactly where this started, or at least part of the early childhood or teenage years, or something, some kind of experience that was way before they came along. It does provide a lot of context. It allows people to be a lot more compassionate, to know that this isn't a conscious choice. This isn't something they're doing to me. This came along way before me, right? So oftentimes when there's a lot of fear, it's not actually about things that daughter has done, right? It's about things that came way before the partner, the daughter, that leads to this kind of shame around this won't go well. So let's learn about where that's coming from. Even just touching on a little bit. It's more stage 2 stuff, but touching on it a little bit provides that empathy from whoever else is in the room. Because just learning a little bit, you know, I did one yesterday where the shame was around, it was terrible. Like, no wonder she can't share. And all that comes up is shame, or to the partner, all that comes up is get off me, right? Like this instant protection, it's physical and I can see it, even like non-verbally, like the gesture of get off me, right? And he's just coming in for a kiss or something like that, right? Partner of 10 years. But I go, we got to the fear. It's like, and she's so certain he's not going to accept the fear. Wow. And so she's shaking around even sharing the fear. Can you remember? And she talked about shame coming up. And I go, can you remember where you had an experience where you shared something like this and someone told you that wasn't okay, or some bad result happened? And she went right into, you know, dad, new stepmom, her brother raped me at 13. And I go to dad and I tell him about it. And since then, I haven't had a relationship with dad anymore. He told me I'm a liar. Like he defended this other person over his daughter, didn't believe me, and no communication after that since then. Like she got ostracized. Like what a huge cost.
Holy shit.
Yeah. Right. And even 2 years later, sister said that to her that she doesn't believe, or that she's lying about that experience. To this day, now she can't talk to sister, right? Okay, now I know why you don't share, and it makes sense why you don't share and why so much fear comes up, right? So all we have to do is ask when these things come up. When resistance is not bad. We just have to know how to roll with it and how to find out where it's coming from, so that we understand there's a good reason for why it's there.
I had so much to learn.
I muted myself. That's why when you said, yes, but is that okay? Well, yeah, it's okay. It's okay because it's there for a reason, and you don't find out the reason until you inquire about it.
Right.
And in this case, it's very similar, right? If daughter believes mom consciously chose drugs over me, she's not aware of mom's experience, right? If she really, really knew it, even to a small extent, she wouldn't believe that, right? But how could she believe anything else given her experience? And I know very little about it, but something around that childhood, continual times they're always drunk and or on a drug, right? They're not going to be present, right? And so multiple experiences led to her believing that.
Okay.
It's just being so scared that I'm gonna not be part of their lives. It's because it kills me every day that I'm not part of Sarah's anymore, and I've had to basically move on as if she was dead in a way, because it hurts so much. And if it happened with the other two, I honestly, it terrifies me every day that it's going to happen. You know, so I'm scared of saying the wrong thing or doing the wrong thing. I feel like I'm under a glass, I guess, magnifying glass.
Mhm.
And if I misstep or misspeak, it's just I'm scared all the time.
And so you try and avoid it, and you try
Yeah.
and sort of pass it off, so that that's your way of coping.
That's all I know.
So pause for a
Because it
second.
hurts too much.
It really.
In what she shared, she already feels, in a sense, what I hear is that she's lost her, right? And I would focus on that hurt, and ultimately it's probably just sadness of loss, of losing her. And the fear isn't of that happening. She's already experiencing it. The fear is of trying to communicate a particular thing and then it not going well. She's punished for it by pulling away, right? That's the fear. But in the moment, I would open up, because what consistently happens is, or what the main attachment is around loss. But opening up the experience of hurt. What is it like to not have her in your life, right? And just deepen it. What you went with was, so what you end up doing, here's action tendency, which is what you start in the beginning. Yeah, you start with that. So this is what you end up doing, right? And so, you know, that's the coping, right? You're asking her if you cope by pulling away, which may be the case, yeah. But to deepen, you want to reflecting is such a big thing. Reflecting is where the therapist decides this is what's really, really you don't decide, but you highlight what you believe is the most important. And what's most important is any of the attachments related cues. So the connection to daughter, when she doesn't have it, there's this huge pain, and just open up the pain.
So that's what
It
I
sounds
asked.
so, yeah, it sounds like it's so painful to not have her in your life. Is that right? Yeah. Can you talk more about that pain? Can you talk about it? Like, what is that like? And slow your voice down.
Yeah, it really does.
And why does it hurt so much? Can you tell?
Because
Eyes
it's
in the
my
head.
fault. Because I could have prevented it.
Does it?
So it's regret,
Does it?
so much regret.
Why is always going to be in the head, and then that's where the self-blame comes in. You asked her, why do you think? We know why, because daughter's important, because she loves her, right? The why is already built into EFT. It's built into the map, right? And you know, and so far she's not there yet. She's using the words absolutely. She's not there yet, right? So in each one of your responses, either you're going to do something that's going to facilitate her going up into her head, and that can come up with coping and what she did there, which is so self-blame, or you can facilitate her going down, and that's kind of the idea.
And like, if I could just rewind the clock, you know.
And so
That's
now,
the problem by digging a hole, right?
So now, Kathy,
You noticed she was going
what
there.
is
You
it
kind of
you're so
intervened.
afraid
That's
of
good.
now?
That's very good.
I'm
Maybe
afraid
focus
that
her on the
even
fear.
after all this, they're still not going to talk to me. That I won't be part of their lives and their kids' lives,
And can you tell them why that hurts so much?
Yeah. So pause there.
because I'm
Where
already
you could have,
experiencing.
where I think you could have went there is, what is that like to not be a part? You're already experiencing it. Or you can say, if that fear came true, what would that be like? If you completely were cut off from their life. She's already experiencing it, just to smaller degrees because she's not really part of their life, it sounds like. So she already knows what it's like. And that's what daughter needs to hear, right? The real investing comes from her doing these enactments because it's such a risk to talk in a different way. And then right now she's kind of talking around it, but she's not touching on the pain, right? So until you can really feel the pain, and we all know what pain is, right? And it's like, is she in her pain? That's when it's ready to be transferred over. And I tend to, maybe this will help. I think we usually tend to avoid the feeling of fear until we're mobilizing ourselves to take action, the kind of action that we're moving towards. Because fear is about the future, and hurt, sadness, even anger is about the now, right? And so if you're going to ask her to do something, then fear will come up. And fear is not a reason to not do something per se. It's a tentative step to go, I'm going to find out how scary this is. I'm going to find a smaller, scarier step, and I'm going to say, I'm going to go, that's exactly where we need to be going, but I just need to find a smaller chunk that's not as scary. That's still scary. That's still uncomfortable, because fear tells us we're going in the right direction as long as we're setting it up for success. And that's why we're here, because even if it's not quote unquote successful, we're still at the worst, it's just neutral, because they can get more information and understand why this is at worst, why the other person responded that way. So a good clear example is when someone does a long enactment, there's so much in there, and it creates multiple feelings in the other side. So we want to go, well, and that's why also 3 minutes is a lot for you to keep track of, but 10 seconds is very manageable, because you can go, okay, in these 10 seconds, it was all vulnerable, or maybe there was like a little jab or a little coping here and there, a little of the old cycle. Okay, good. So out of that, I can anticipate that it won't be received perfectly well, right? Or even if it's 5 seconds and it went perfectly, it could still not be received kind of perfectly well, because how much pain is there from the past, whether it's before this relationship or even during the relationship, that's preventing me from, and I like this kind of concept, preventing me from being present to the other person's experience. Where am I going? Where does my experience go? Does it run away from what's happening in the room right now? And if so, it would have, sure, some of it could have been a trigger, and for other people, it could happen no matter what. And so it doesn't ultimately matter that much that we didn't do a perfect enactment. What matters is that we follow the experience. So to not have to overthink it. If you feel the experience of the person sharing is enough of a primary experience for them to turn and share, you share, right? And then if you're seeing that the receiving is having some kind of not just compassion, but something else is coming along with it. And by compassion, it could be, we're talking empathy, we're talking reassurance, we're talking the kind of reinforcing response that will help the person that's sharing do more of that, right? If you get anything other than that, you want to explore what happened, right? Because it could be that, yes, they can identify, oh, when they said this, that was a trigger, and that's really helpful. Or they can identify that, you know what, I don't know why. And yes, they looked, I had this week, yes, they look genuine. And a part of me would love to let it in. And this is me reflecting what they actually said. Part of me would love to let it in, but it's so hard. Why is it hard? Because it's a big risk. Because if I do it, I start to begin to trust them again. And that means I could get hurt again. and that's on, then it's on me. So I have to go slow. Okay, that makes sense. Or I've heard something like this before, and then the shoe dropped again. So it's a risk. It's not just, remember, it's not just a risk to share. To change your protective belief is also a risk. Just because someone's sharing completely vulnerable doesn't just mean, hey, that's a guarantee. No, it's still gonna, if there's enough pain, especially if it's projected onto this person, and it may not even be them, it may just be the past for them, but it's projected onto them, and that's okay, that's protected, that's necessary. And so it's just about learning to let it in, even if they can let it in 5%. Okay, 5%, that's enough to give the other person reinforcement that they're on the right track. Sometimes a good enactment back is just like, I know that you shared genuinely, and a part of me would love to accept it, and maybe even a part of it does, but I can't right now. It's too scary. Because now it's nothing to do with how the other person shared. They find out you shared brilliantly, and you can help validate that as well. There's nothing you did that's wrong. You did so much good. And that allows them to go, okay, it's not me. And again, the more context about what it is that's creating the resistance, the better, because again, is that genuine? When it's coming back as an enactment, or at least that they're really, when a person shares, they're very hypersensitive to the response, extremely, because they're putting themselves out there. The next thing coming out of the receiver's mouth is so crucial. So we need to be protective of that and honor that they're taking this huge risk, even if they didn't share perfectly. Part that was scary, even if it's like, sometimes those extra things are just to protect the scary parts, right? And they happen automatically, right? So again, it's never clear cut. It's following the experience, and we'll always give additional context.
So, excuse me, when I go into the next session, is it okay to sort of start up with validating how the mother shared, and like validating how difficult it was for her, and then
If that's where she's still at, I think, again, if they're at a different place, if she's already forgotten about it, I would want to know where they're at first and foremost. Where are they at? And you can ask, what was that like? Maybe I had a sense that it was, to get that response from daughter was really hard. Is that true? Like, you could do that. I would do it more as an observation, as a reflection.
yeah,
Without again, without assuming that it did have that impact. But you're probably right. It's just, will that be taking away time from daughter today? And so this is a good, efficient way to let them lead. Yeah.
because when I listen to you talk about the whole balance of it, I realized that I didn't really sort of explore that and break that down with the daughter, that yes but thing, and the way that you did it is just really, really
Yeah.
interesting.
No,
And
I understand. Yeah.
I'm
No, I
wondering,
understand. You wanna like a redo in a way, and I understand that completely. You'll get those. You'll get those, absolutely. You'll keep getting them. If they're coming back, you'll always get the opportunity.
okay,
It's just, is it alive in the room, and is it following the experience is the question, and it may or may not be, right? Yeah, it's like the mental state of the present moment is what matters.
so when you go
And
in,
yeah, and also I would just say, I wouldn't worry about it too much. The reason is, they've been through much worse. To get where they're at, they've been through so much, right? And their current cycle, they've survived it enough to get here, to get in the session, to want to work on this. Their attachment has survived all this. It doesn't mean it's thriving, of course, but it's survived it enough to get here.
so
So anything that happens in session is nothing compared to what they've been through already.
so what would you suggest in the next session? Like, how do you open it? How do you get into um, sort of into another discussion area where you can then sort of peel away the layers.
I wouldn't necessarily change it from any other session. I usually start sessions with kind of one of two ways, you know, just walk me through what it's been like since last time in terms of if you've got any insights from the last session, meaning I'm extracting some of the positives, and then I'm also trying to in the same time assess, you know, are they aware of the cycle, or are they aware of what's going on between the two of them? Or you can go for that directly, right? Like, what has the last week, 2 weeks been like as far as the cycle? Are you guys catching yourselves more? It really depends on what we did last time or where I feel they're at overall. And I want to get an assessment of where they're at in order to know where are they at, so that we know where they're still stuck, where they're still at that edge of where they're still stuck, where they're still falling into the trap, right? And that often leads to tell me what happened this week, you know.
But they don't interact between sessions.
Oh, okay, so that's helpful. So then what's the insight when you thought about the session last time? What did you take away from it? Yeah.
Okay.
What was helpful? That's still a way to both reinforce the good and also to assess where they're at, right? And then of course they give you that, and then you can say, what's that like to hear? This is what they took. What's it like for you to hear? This is what they took away. And then, you know, what's still, essentially the question is, what's still left to be worked on? Where do you think the gap is? And most likely next time I would work with daughter or son. Most likely with daughter, it sounds like, until it's again equal risk taking on both sides, right? So you'll have probably either son or daughter because they have a similar experience sharing, and then the next time, you know, mother. And you know, I'd be curious about just having sessions with to make it even more fine-tuned, just mother and daughter. If maybe not right away, but as soon as mother sounds ready, but as soon as daughter's ready, I think it'll be less distractions for you.
Okay.
Yeah, something to think of. You're kind of
you.
already doing that in a way in these sessions when they're just the father and son are kind of more witnesses, it sounds like, but you follow the pain, right? That's what I would say. You follow the pain. And sometimes you do end up doing enactments 2 in a row, so, you know, with the same person, like one session and again, because you're working with the other person and you see there's too much pain on the other side. They're still way too triggered, right? And so you go back, right? And there's a limit to that. It's only if it's real pain, as opposed to just coping. Sometimes you get pursuers that they want to run the show and they're coping. You don't want to reinforce their coping. It's a gray area, but you don't want to reinforce what they're doing as a way to cope, right? So some pursuers, right, they want to run the show. I used to make this mistake, and so for I don't know, 10 sessions, this is very early on, like 2014, 15, when I was just starting with EFT, there was a female pursuer, was a counselor, and an experienced one. So I'll let her lead. She brings in all these worksheets, all the things they did in between the week, and we often would always focus on him, and because it was too hard for her. But that's my mistake. Just because something's hard doesn't mean I should take her lead and always focus on him, right? And because then, yeah, it isn't balanced. So you have to know whether it's a coping or whether it is real pain. And so sometimes when it's just a coping, I just soothe it for a moment. Yeah, this is valid, and we'll get to you. And right now, today, we're going to be working with him, right? And or even better, as I build a relationship. I know this is really hard to sit with, and we will come back to you and check in with you to make sure you're okay. But can you trust me to work with him for the next 5 minutes? And trust me that in the end of the 5 minutes, I think you'll be at a different place. So whatever amount of time you think it will take with the other person to get them to a deeper place, deep enough that you're close to an hour. Because remember, as they go deeper, it will calm the pursuer's nervous system, and vice versa. As a pursuer goes softer, it shores up the withdrawer. It brings them to the table. They get more invested, really because they're feeling more safe. They're seeing this other side. So that's what you want to do, is you want them to see this other side. That's the new cycle. As they see it, they get more invested, right? So it's okay. They get triggered and they're in this part of the brain. You soothe it a little bit. They don't have to be perfectly calm. They just have to be calm enough that they can suspend their reactivity, so that then by the time the other side gets to a distilled, like deepened place, then they're with them, right?
Okay,
That's the
thank
good.
you so much. I better let you
No
go.
problem.
I appreciate
Right,
it so
sounds
much.
good.
Have a good weekend, okay?
You as well. You as well.
Okay,
Take care.
bye.
Bye-bye.